We have adverse events, but the adverse events are nothing that was outside of what we would have expected. So the majority of the adverse events centered around respiratory depression, requiring bag mask ventilation. But no patients were required a endotracheal tube or major airway intervention to rescue that issue. They generally responded to maneuvers that we were all trained to do. So as part of CAPS, you have to go through a very specific training protocol. And I think that the use of this medication, because we've gone through this training protocol, and because there is a higher, I would say, not necessarily risk, but higher degree of respiratory depression with this medication, the profile or the window in terms of its ability to cause that is more narrow than some of the other medications. I think it's made our team as a whole much better at providing moderate sedation via whatever means we decide to do it. And I think that's been one of the unanticipated upsides of putting this machine into practice, because we're so, the safety associated with this machine is, I think, been the biggest question that's been out there. If you read some of the lay press on this, there is concern, and so the team is very attuned to and has been trained. The training has allowed them and the entire team to kind of be very mindful of this and pay and perform that component of the monitoring, I think, better than has been done in the past. I think that what we're showing is that there's a lot of sensationalized concerns, if you will. It's not as if they don't. It's not as if we're not worried about. With any type of procedure, with any device, with any drug, we're not always. Patient safety is the number one priority in what we do. But I think in our study with now using it in over 1,000 cases, that we can demonstrate that the safety profile of this is very, very good. And some of those major concerns that were out there, have not borne themselves out in clinical practice. So we're going to continue to study this. We're going to continue to study this in terms of not only safety profiles and satisfaction, but we also want to understand really how we can create additional efficiencies in our endoscopy unit by using this. And so how do we take that recovery time and improve it? I think that when a patient leaves the endoscopy unit, how they leave is really important. In other words, you can have a patient that meets recovery parameters, but if they walk out the door and they don't understand, what you found, and if they don't remember what you found, and if they have to call you the next day, versus, that's an issue. And I think that the patients who undergo CAPS leave the procedure unit in a much different kind of, I wouldn't say state of mind is not the right term, but their ability to recall and comprehend and ability to understand what the next steps. The patient should always leave with a plan that they understand, and I think that's what they have. And I think if we can continue to enhance that so that perhaps we start to bend the needle on patient overall satisfaction, that would be a significant advantage.